This is the Carl DeMaio Show. We're giving you the story behind the story. We're leading the fight to take back our state for a better California. And we're going to continue our conversation on healthcare reform. In my last podcast, I talked about why Republicans were making a mistake in not having an alternative plan to Medicare for all, a real plan, a detailed plan, a comprehensive plan for healthcare reform. Healthcare is a super important issue for millions and millions of voters, particularly the toss-up voters. And these are emotional issues. We're talking about people who are diagnosed with an illness, or their loved one is diagnosed with an illness, and then they can't get quality care. It's also something that people are reminded of, the failure of our healthcare system, every time they look at the deductibles and the payments that they have to pay for their health insurance. Republicans don't have a plan. Democrats do. Democrats' plan is bad. It's government intrusion. It's the reason why we have explosive costs in our healthcare system. But at least Democrats are offering a plan, and that creates the danger. Not only that Republicans would lose elections, more importantly, that we won't get the healthcare reform that we need in this country to get people the health care that they require. And so I'm offering at least a starting point of a plan. It's called FreedomCare. Yeah, FreedomCare. Because, you have ObamaCare and you got Medicare for all. And those are, nice sounding terms. Affordable Care Act. Well, okay. Well, Republicans never are good at branding their proposals. The reason why I call my plan FreedomCare is that it's rooted in the individual and their right to choose their health care. That they have inherent freedom to decide what's best for them. What medical approach, what treatment, what wellness is best for them. Giving them healthcare choice and control. Freedom care. Whereas with government, we have no control, no choice. And so my Freedom Care plan, which is at freedomcareplan.org, can be summarized in the following sets of reforms. First, we start out with the comparison. Under the current system, you pay for health care. Under Medicare for All, the Democrat plan, you pay for health care. You just pay more through higher taxes. Under Freedom Care, you pay for health care. But who decides? You pay in all cases, by the way, all right? And the Democrats are trying to pretend like it's free. It's not. You pay in all cases. You pay in the current system through your taxes and your premium. Under Medicare for All, you pay for that based on higher taxes. And under Freedom Care, you pay based on Freedom Care contributions that you put in your own account. But who decides where that money is spent? Under the current system, someone else does. No, not you. Someone else decides where your health insurance taxes and your health insurance premiums are spent. It's either government decides that for you or an insurance company. That's the current system. You have no real control. Now, you can pay out of pocket for things. Oh, yes. But your insurance company decides whether they will approve a treatment. Same thing with government. Under Medicare for All, insurance companies are taken out of the equation. Government decides everything. Under Freedom Care, government doesn't decide. An insurance company doesn't decide. You decide. With input from your healthcare provider, but ultimately you are the decider. And also, choice of coverage, choice of doctors and healthcare providers. Under the current system, you have some choice, in-network, out-of-network. If the insurance company allows, if government allows, you have some choice. Under Medicare for All, you have no choice. Government gives you your doctor, and you're stuck with it. They get to decide. If they want to take away that doctor, they can. Under Freedom Care, you have complete choice. You get to decide what plan you want. You could also decide what doctor you want to go see, what healthcare provider you want to use. The principles of Freedom Care are, number one, individual control. Patients should control their healthcare decisions with unbiased input, no pressure from government, no pressure from insurance agencies, unbiased input from healthcare providers. The patients control all healthcare decisions. Second, it's lower costs. Affordability drives our decisions. How do we cut regulation and mandates? Third, innovation. How do we embrace technology and innovative medical practices? Fourth, accessibility. How do we provide easier access to healthcare services and integrate our healthcare management? And finally, fifth, accountability, making cost and quality ratings transparent to patients and holding providers accountable for results. How does FreedomCare work? First, FreedomCare is both a actual healthcare plan that you can enroll in, and it's also a healthcare reform program that makes changes across the entire healthcare industry. And so I want to talk about the two separately. But first, let me talk about the healthcare plan. We're going to actually create a FreedomCare option that you can enroll in. It's kind of similar to what they said ObamaCare was, although that was all provided through insurance companies. Notice how the insurance companies always profit. The insurance companies are always protected under the government system. Under FreedomCare, we cut the insurance companies out of the equation, and we go directly to the relationship between the healthcare provider and the patient, you, the individual. Under FreedomCare, we would first start out by announcing the creation of a FreedomCare provider network. We would ask doctors, nurses, home care groups, hospice groups, hospitals, medical practices to step forward and enroll as a provider in the FreedomCare network. Now, why would someone be willing to enroll in the FreedomCare network and provide services through FreedomCare? Well, they would be given regulatory relief. We would slash mandates and regulations. And I'm not just talking about nibbling around the edges. I'm talking about wholesale elimination of the rules, the regulations, the mandates, the costs. What I'm basically saying is provide services. We are at a healthcare crisis. Just treat the patients and take care of healthcare outcomes. I don't care how you get there. Just do it. We're in that big of a mess with healthcare. We have to start allowing you freedom and flexibility to provide your services. That includes tort reform. It includes eliminating overly prescriptive labor regulations at both the federal and state levels. All of that would be eliminated. We would allow them access to a workforce because there's a healthcare workforce shortage based on anyone applying for visas under healthcare programs or anyone receiving college tuition assistance for a medical program in a college or university. We would guarantee prompt payments. A lot of providers are going broke because they're not given prompt payments for their invoices. And finally, we would give them share in the savings bonuses based on performance. Now, you have network of providers. Now you need people. You need consumers, right? Okay, so how do we set up the consumers? That's where we allow individuals to create and open up FreedomCare accounts. The FreedomCare accounts are modeled after health savings accounts, but instead of paying an insurance company each month, each individual contributes to a FreedomCare account in their own name. They pay a base fee, and that covers free preventative care services, and it also starts putting money aside for some of the services they may want to tap throughout the year. A good amount of money also goes into a catastrophic care insurance fund. That's only to be used in extraordinary healthcare emergencies and with a major diagnosis with a high cost of treating your illness. All of these payments would be tax-free, by the way, both the employer and the employee contributions to these accounts. And all the funds within the account would remain within the control of each individual. Third, we would negotiate FreedomCare discount pricing. We would make prices transparent. All the FreedomCare providers would have to provide a lowest accepted rate for every service that they provide, and they would also have to bundle their services into, fixed price, flat fee, bundled agreements. We'd also work out share and savings agreements whereby they would take someone on with a catastrophic care diagnosis and deal with all medical services for that individual based upon outcome-oriented healthcare performance. After we establish those prices, we then would move into a healthcare portal so that people could actually buy the services they need from the providers. Now, coming up, let me explain how the healthcare portal would work on FreedomCare. But first, these messages.
Carl DeMaio here. From rating our road improvement funds for bus and bike lanes to gas taxes and congestion taxes, politicians keep making it harder to drive. Traffic will only get worse unless we demand change. Join me, Carl DeMaio, by signing the petition at fixsandiegoroads.org.
Carl DeMaio thinks it's time to clean up the mess in Congress and take a new approach to solving problems. That's why Carl DeMaio is proposing the Fix Congress First plan. Make Congress live under the same laws the rest of us do. No special exemptions. Eliminate lavish congressional pensions and other perks. Force Congress to open up its own books and records to public review. Make Congress read the bills first before they vote on them. No budget, no pay. Permanently take away Congress's pay for every day the budget is late. If we want better results from Washington, we need to start by fixing Congress first. That's why it's time to help Carl DeMaio get his Fix Congress First plan enacted. Sign Carl's petition and help fix Congress first.
You're listening to the Carl DeMaio Show, and we're talking about healthcare reform and my FreedomCare plan. We just talked about some of the elements of the FreedomCare plan that individuals could enroll in to receive healthcare coverage in the U.S. First, we would create a FreedomCare network of healthcare providers, and the reason why they would join it is that they would be excused from all the government nonsense, the regulations, the cost increases associated with mandates, regulations, fees, restrictions. Second, individuals would join the FreedomCare healthcare network with individual FreedomCare accounts. They would contribute, and their employers would contribute on a tax-free basis. Their contributions each month would go to cover free preventative care services. A little portion would be put in to basically cover the preventative care services, and it would also start allowing them to build up a health savings account for basic medical care services they may want to elect to receive throughout the year. And that balance would carry over year to year. Also, they would be contributing to a catastrophic care insurance pool that would cover any extraordinary health care expenses that they may require, but only under catastrophic care conditions. Now, we've got the network, we've got the individuals with these accounts, we've got pre-negotiated lowest rate pricing for them. We also have a portal. The portal is basically like an Uber or Facebook, and it basically combines your medical records, but also allows you to track your own medical progress, allows you to interact with healthcare providers, book appointments, pay for services, all in one integrated platform. It's a marketplace using technology. But what's so important about this marketplace is it also has all of your healthcare information that goes from provider to provider to provider, allowing you to equip your providers with all the data they need to manage your wellness. It also allows you to manage your own wellness by putting information in and opportunities in to help you set goals. You work out more, lose weight, stop your smoking, take some good vitamins, deal with whatever issues you might have. It's preventative maintenance by providing you with information you need to make for good decisions. We would also take a look at how to rate your own health. And we would require a annual biometric screening, basic blood test, and an examination, so that your medical provider has information to manage your wellness, but that you also have information to manage your wellness. And we would rate your health. And you would pay more for catastrophic care if you are, well, frankly, not taking care of your health. You pay based on your own actions. If you lead a healthy lifestyle, you pay less for catastrophic care coverage. If you are slovenly, smoking, engaging in bad behavior, if your numbers are off the chart, well, then you're probably going to pay more, as you should. Actions have consequences. And that's what FreedomCare is all about, empowering the individual, good and bad. Now, the FreedomCare program would bend the cost curve, making healthcare much more cost efficient, and allowing you to decide what health coverage, what health care, what treatments, what services you want to access with input from your doctors. But you would ultimately decide what services you would afford yourself. And if you wanted to say, look, I'm not good at making decisions, I'm going to pay you for performance. You get a basic flat fee. What is the bundled rate? That would also be an option under FreedomCare. Now, FreedomCare is not just a healthcare plan. It's a healthcare reform program nationwide. So if you're not in FreedomCare, we're still going to enact other reforms that would make healthcare more affordable across the entire marketplace. So you know those regulations that we cut for FreedomCare providers? We would take some of those regulatory changes, cutting red tape, and we would apply those to the entire healthcare industry based upon what works with FreedomCare providers. Third, next, we would encourage innovation and expand access to technology. This is where we would do a 10% innovation fund from the NIH budget. These government bureaucrats are always spending grants, basically giving grants to each other. It's pretty corrupt. I would take 10% of the NIH budget and I would give it out in the form of share and savings grants and performance and innovation incentives. We'd also deal with tax incentives, negotiate prescription drug prices, and we would also continue right to try. This is where you can use a treatment or a drug before the FDA has approved it. You might say, but Carl, government needs to approve it first. Oh, spare me. People are dying, all right? If people want to make an informed decision to try something that's not yet FDA approved, so be it. Butt out of their decisions. Let them have the right to try in this country. Fourth, we need to cultivate a stronger healthcare workforce. This is where immigration reform that the president has proposed with the RAISE Act can come in. But also, we have to reform state licensing programs to make it easier for people to actually perform some of these healthcare services. The licensing programs at the state level are rackets. It's basically healthcare professionals trying to keep other healthcare professionals out of their own industry and their own business. Let's relax some of those regulations and open up the healthcare workforce. We also need to take a look at expanding healthcare choices for consumers that don't want to enroll in FreedomCare. So, for example, we can do bulk purchasing power by doing a program where people can buy insurance across state lines. That enhances competition with different healthcare programs. We can allow people to buy insurance through the Federal Employee Health Benefits Program, which is a pretty well-run system that increases the size of their risk pool, drives costs down, allows you to get the same coverage as government employees. Hey, if it's good enough for the government bureaucrats, it should be good enough for the taxpayers. We also should look into the insurance companies and give them a bit more oversight, because I think some of these insurance companies are pretty darn corrupt and as bad as government bureaucracies. And so we would look at how we change the health insurance market outside of FreedomCare. Medicaid, 5% of the population are accountable for 50% of healthcare costs, and most of those folks are in Medicaid because it's the poorest and the most at-risk populations. All of this is paid for out of taxpayer funds, but it's also paid for by you as a healthcare consumer because providers don't get reimbursed adequately under Medicaid, and so they pass the cost of Medicaid patients on to you. That's a dirty little secret in healthcare. It's the cost transfer that goes on behind closed doors. So under Medicaid, we would apply some of the share and savings and performance-based pricing models from FreedomCare to Medicaid providers, again, to try to bend the cost curve. And finally, VA healthcare reform, kind of make sure that our veterans get quality care. And that's why I would force Congress, members of Congress, to get their health insurance, health care from VA hospitals. Oh, yeah, you want members of Congress to be involved and eager to have better care for veterans? Force them to get the same quality of care as our veterans, and you'll see a lot of improvements in the VA healthcare system. We also need to make sure that VA, the veterans, continue to have that option to go outside the VA system if they so choose to get access to their care. That's the FreedomCare plan. We raced through a lot of stuff there because we have limited time, but I want you to read the whole plan if you have a moment at freedomcareplan.org. That's freedomcareplan.org. And I would appreciate your feedback, particularly if you're in the medical field, if you're a doctor or nurse or a hospital administrator. I think there's a lot in there that you'll find resonates because I listen to healthcare professionals in developing the plan. We can either continue to let government intrude itself into the healthcare market, raising the cost and diminishing the quality of care, or we can offer alternatives that don't involve government. Here's a novel concept. Trust our doctors and our healthcare professionals to treat patients, and trust patients to make decisions on the quality of care they want. Government doesn't make better decisions. Government actually ends up making worse decisions than even individuals that are out there trying to make decisions with the help of people who know what they're doing, the healthcare professionals. Check it out. FreedomCarePlan.org. We'll pick it up next time on the Carl DeMaio Show. Spread the word, carldemaio.org. This podcast was paid for by Carl DeMaio for Congress. I'm Carl DeMaio, and I proved this message.